kind of issue. Thanks, Elisa. Okay, so welcome to this Arizona State Loan Repayment Program. Like I said earlier, my name is Edith DeSanto, and I'm the Primary Care Office Chief. Our office is really a really small office. We have only 2 full-time personnel dedicated to this office. You probably worked with either me or Thelma during your application cycle. And Thelma is on leave now until probably the end of December, early January. So, and anytime from now until December, January, feel free to reach out to me with any questions. So I'll be your primary point of contact during this transition to get you onto the program and to do your first quarter encounter reports. But Thelma is one of the people in our office, and she's really great for any questions and ongoing things in the future. But during this time, she is out. So a little bit about the primary care office. The core function is to help strengthen systems for primary care and in the state of Arizona. We, have this program to administer to increase the number of providers and increase services in underserved areas, and that's what you guys are doing for us. We also work on the data and evaluation for the HPSAs. So our office collects all of that data and submits it to HRSA for HPSA designations. And then we do also provide technical assistance and outreach for the NHSC Nurse Corps programs as well. So our office works closely with the HRSA office for NHSC and Nurse Corps. So with any of those questions, I know you guys aren't part of those programs, because to be part of the Arizona State Loan Repayment Program, you can only be obligated to one program. But if in the future, our office also does that. So we are the Arizona Department of Health Services. So we are a state agency, and within that, we are in the Division of Public Health Services, and then we are in the Public Health Prevention under the Women and Children's Bureau. So that's kind of where we stand in the organization. So welcome, and thank you for your commitment to the Arizona State Loan Repayment Program. Our office is committed to ensuring that we can support you and make sure that you finish your obligation and that you have a positive experience. We must work together to make sure this is happening. We know that, throughout the 2-year service commitment that you guys are embarking, things might change and there's adjustments that need to be made, but working together, we can make sure you meet your obligation, comply with the programs, and understand what kind of options you have. So communication is key in that. So I'm quickly going to go over the different parts of your contract. I know most of you, if not all of you, have received a contract from our procurement office. So I'll go through the contract. So one thing is to read your contract thoroughly and ask any questions. So there's 5 pieces to the contract. And if you have not received a contract to sign by the end of this week, well, today, then please reach out to me so I can follow up with your procurement specialist. I know there's a couple of people who haven't received their contract because of other issues, but let me know if you still haven't received a contract. So the uniform terms and conditions, these are from our state procurement office. So these are things that apply to all vendors, and they're based on the procurement code for the state of Arizona. We cannot make any changes to that. And it just talks about, the requirements, the liabilities, and these are just very boilerplate terms and conditions for the state of Arizona. So that's page 2 to 9 of your contract. And then we have the special terms and conditions, and these are specific to the state loan repayment program. And then these some of the things are like suspension, cancellation, different things that are special to the state loan repayment program. So this is on pages 10 through 17 of your contract. And then the scope of work. This just talks about the program in general, like if it's full-time versus half-time, any of the small requirements for the program. So if you have any changes or anything like that, you need to submit a request for change. So I'll talk about those in a little bit. So that's what the scope of work. So it's the obligation of you as a program participant. And then the price sheet specifies the amount that you'll be reimbursed for your service. So the way the state loan repayment program works is that we disperse quarterly payments to you after each quarter of service, and we submit it directly to your lender. And then if there's any changes in the lender that the payment needs to go to, or the amount that needs to be paid to a lender, you please let us know, because then the lender will send it back. So if there's a situation where you only had a balance of $2,000, but your quarterly allotment was $5,000, then the lender will reject it and send it back, and it will cause a delay. So it's up to you to let us know how payments need to be sent to lenders, and change your loan priority for that. And these can always be done via the portal, and it needs to be done before your quarterly payment is sent out. And then if for anything you receive a check directly or things like that, you can send return checks to the accounting department at the address listed below. And this is on page 21, where it has your contract amount and your quarterly payments. And in attachment A is a sample in service verification and encounter form. So this is what are going to be sent to the program every quarter for payment. So you complete 90 days of service, and then you will complete a service verification and encounter form via the system together with your site admin. And then after that, we will process payment, and that will initiate your payment to your lender. So there's reminder emails that are generated to the system. You work with your site admin to complete it online, but you must download it and sign and get notarized each time. And this is what will process the payment. And this is page 22 and 23 of your contract. So, it's up to you to work with your site admin to get this completed each quarter for payment. So request for change. So request for change is required for any of these 6 items, but it also is required for anything that changes from your initial application. So if you have a name change, an address change, or anything like that, you'll have to submit a request for change. So these are just examples. If you need to change employer or service site, or you need to add another service site, those are required. If you decide to go from full-time to half-time, that will be required. If you need any changes in the loan information, it all goes through the request for change process through the portal. And if you have a home address change, we will also need to change that in the APP system, and we will work with you to get that done. Another possible change is if you had to take a suspension or have a gap in service, that will also require a request for change. So one of the things, if at any point in the 2 years that you are obligating yourself for, you desire to, change employers or service site, it's always important to check with our office to make sure that your new service site is an eligible service site to be part of the program. So you just want to make sure you check with us, and then you request a change in the system, and then upload any copy of a contract or letter or change in the service site, any documentation of that. So that's if you're changing an employer or service site. If you're changing service hours, that also requires it. And then we would need an updated employment letter indicating the change in hours. So it's just the information that's needed. So I think most of you know what your award amount is, but it's based on your HPSA and your provider type. So this is for full-time awards. If you're half-time, it would be whatever your HPSA is, and then half of the amount for a half-time commitment. So typically, change in service hours are only granted at the time of renewal. So if there's any reason that it's temporary to change your contract, then we suggest that you do a suspension for that time, and then resume your contract at whatever your current contract is. So I'll talk about the 3rd-year continuation a little bit more, but that's really when we can change your request for. That's when we really can honor your request for a change in service hours. So if you have any loan information that needs to change, like either you get notice from your lender that the address has changed, or they sold your loans, you need to request submit a change request in the portal as soon as possible to make sure that your next payment is submitted to the right place. And you would go into the portal and submit it, and then you would have to show documentation of the lender address if it's new, or if it's been consolidated with other loans or anything like that. You would just need to submit documentation for whatever change is happening in your loan. So if there for any reason you are needing to take a suspension or a gap in service, just please reach out to us so we can work with you to determine what the best way to approach it is. So typically gaps in service, you can do up to 6 months suspension at a time. If you want to transition to a different employer and you're looking for employment with another SLRP qualified employer, that can be done for that. And then one of the other things that is in your contract is that you have up to 7 weeks or 35 days per year to take time off. That can be for sick leave, vacation, anything like that. So anything that's above the 35 days per year must be communicated to us to work through what kind of, if it's going to be a suspension or anything like that. So for example, if someone takes FMLA for 12 weeks, 7 of those weeks can be towards this 35 7-week gap that's allowed per year, and then we would have to extend your contract for 5 weeks for you to fulfill the 2-year obligation according to the contract. So filing a request for change. So this will be initiated by you, the provider, signing into the PCO portal where you submitted your application. We do have a 12-minute video how to do it in a step-by-step manual. So I'm not going to go through that, but Thelma put together this quick video, and I can just show you like the first couple of seconds to for you to see what where exactly you would go to start the process.
Hi y'all, so I'm going to show you how to make a request for change in the state primary care portal. There is a standard guide to that. So if you ever need help or you just quickly want to make a change and you'd rather just read through something versus watching a video, perfectly okay. It's a standard guide with pictures and everything that walks you through step by step how to make that request for change. So we will go through that right now. So if you're here, you've logged into the PCO portal.
So here you've logged into the PCO portal already.
This is what you'll see. As a provider in our state loan program, this is what you'll see. So you'll see that you'll see your applications that you submitted. So you'll see your initial application here. It'll say new, and you'll see it here, and you've been approved, and you've accepted that approval. As you can see, your status is here. You've accepted it on your end. You're going to be able to see this request for change button right here, and this button basically allows you to make any changes to your application after you've been approved and after you've been accepted. So it won't let you, you're probably not going to see this button and won't have access to this button until your application goes into the approval status, which by this time you guys should all be approved and accepted.
So that video will be loaded and you can watch it at any time where you need to submit a request for change. And then the manual is on our website. And I wanted to take a quick second to also point you to the website. So I'm not sure if everybody is familiar. It's the ADHS website. And then if you go to Health Systems Development under Workforce Programs, then the loan repayment programs, a lot of the things related to your contract are spelled out here as well. So if you go to the contracts, it's, anything like this, and then it has a request for change. And under here, it tells you, like, it'll take you where to sign in for it. And then you can, the guidance is also here. So we will load the video here as well. So if at any time you need to submit a request for change, if you change your address, if your email needs to change or anything like that, there's a step-by-step here, and then there'll be a video to show you how to do that exactly. So we're always here to help, but we just wanted to make sure to give you the resources to be able to a request for change. But if there's ever any doubt on, what changes need to be made for your contract, or if this requires it, feel free to reach out to us at any time. So after you sign your contract and get an executed contract from procurement, really the next steps for you throughout the program is really to complete an encounter report to initiate the quarterly payments to your lender. And then, make sure you keep us updated with any changes that need to happen, or if you need to take a break or anything like that, just to make sure that we are, in the loop and helping you make sure you meet your obligation for the 2 years service obligation. So the quarterly encounter reports are completed not by you in the system, they're completed by the site admin. So you do not have access to submit it, but you do have to work with your site admin to sign and get that ready for submission. So the site admin will go into their portal and process your encounter form, which will then give a PDF form where it needs to be signed and notarized by both you and the site admin. And then after it's signed and notarized, then it's uploaded back into the system for processing by the site admin. So just to make sure that sometimes, only certain pages get uploaded, but we need the entire form to be uploaded and notarized. So we need a completed form to, move forward with payment. So this is in your contract. This is just an example. So these fields will get auto-populated when your site admin completes it in the system. And then these are the fields where you as a SLRP participant will need to complete. And then the site admin will need to, process and sign and then get it notarized as well. So it needs 2 notarizations, one for your signature and then one for your site admin signature. So after we receive that form from your site admin for your 3 months quarter service, then we process those forms and submit to finance for payment. So then they, finance completes their process and they send a check to the lender that we have on file. And you can have multiple lenders, up to 3 lenders. So we will send 3 separate checks, and you would need to tell us how much of each check, how much of each quarterly payment you would want to send to each provider. So it's really important that you, communicate to us any changes in lender payment address, or if, one of your loans is done, you're done paying it or anything like that, just to make sure that payments are processed correctly and we don't have return checks because they get lost in like the Treasury's office because they get sent back to the Treasury's office for the state of Arizona, not to our office. So it's really hard to track those down. So it's really important that on your side, if there's any changes or your loan is coming up for payment, that you communicate that back to us before the check goes out to avoid any delay in payment. So once we mail out the check, then in the system, will notify you that it was sent out. And if you have any issues that you don't think your lender has received it, then just feel free to reach out to us and we can verify when the check was mailed and things like that. So I see a question in the chat box. Is there an easy way to let you know about loan changes through the portal, or is it better through email? So that's any loan changes are also done through the request for change process. So you would have to file a request for change, and these requests for change are for anything, for your name, for your address, for a change in how the lenders get paid. So anything like that, you would go through the portal and submit a request for change in the portal. Does that answer your question? Okay, perfect. All right, so one of the key takeaways from today is, communicate with us. If you have any questions, feel free to reach out. But there will be a system, a way for us through the system to let you know when the check was sent out each quarter. So if at this time, this is only for this time, if you wish to make any changes to your loan, because you've already submitted your application at this time, but this is only for right now before we start technically your obligation. If you need any changes at this point, please let me know and I can send you this priority of loan form. This is only for now, but in the future, it's always done through the portal. Okay, so for contract suspensions, so this is for any significant gap in service. So if you have any reason where you need to take significant time off above those 35 weeks, we will have you fill out a suspension request, and that's just letting us know that you would like to take a certain amount of time off, and typically it's 6 months are given at a time. So if you have any, if you're going to thinking of changing employers or anything, any other life event or medical condition, we can work with you on filling out that suspension form, communicate with us, and then we will work with you to file a request for suspension, which is now available electronically. And we will, you will submit your request, and we will, review it and approve it. If there's, if more than 1 year is requested, then according to rules, we might not be able to approve it. So you will submit your request, and then we will let you know of the decision. So you can have 6 months, and then a maximum of 1 year total. So during your suspension period, it's really important to keep us updated of any changes. If during your suspension you need to extend it or anything like that. So if you are doing a suspension due to changing the service site, if you terminated your employment with your original service site and are still looking for another one, if you are not able to continue and work in another approved service site or eligible service site, you might be considered default. And I'll talk a little bit more about default in a minute. I see a question in the chat. Fed loan servicing contract is ending soon. Our loans will be going to a new servicer. Is this something we need to submit for documentation for? Yes. So anytime we will be changing, who the payment goes to, or the address, or the account number that is being paid from our office, we need to know about it to make sure that we route the payment to the correct place. So we send the payment with your account number, your name, and the address that we have on file. So if any of that is changing, or into the servicer that we have on file, so if anything of that is changing, we'll need to know about it to make sure we make the adjustments. That we don't know, we don't have any access to your information. Even when we've sent checks to servicers and we have the check number, they usually don't give us any information about. They don't give us any information about people's loans. They keep that. We don't have any information other than what you give to us. So we're very dependent on you making sure you update us with anything that changes regarding your loan. Does that answer your question, Maria? Okay. All right. So defaults. So providers are deemed in default if you fail to complete the terms of the loan. And the penalties for defaulting on state loan repayment programs loans are very steep, and they're consistent with those from the NHSC program. So we really try to work hard with providers to make sure you don't find yourself in a default, at risk for default. So we want to make sure we work with you, but I'll go over the penalties. So there's a formula for calculating it, and so it's whatever has been paid to the participant for any period not served, plus the amount of months not served multiplied by 7,500 per month, and then interest on that. So here's an example of a 2-year person who received $65,000 and then defaulted after 6 months. So it would be 65 times 75%, So that would be for $48,750, and then they haven't served 18 months, so that would be $135,000, and then interest rate. So on top of that, $183,750. So the the penalty for going into default for these for this program is really steep. So we really work with you to you don't find yourself in that situation. So maybe you communicate with us if you find there's something happened, or there's something going on that you can't fulfill your service obligation.
Edith?
Yes.
If the amount is paid quarterly and you default, how are you defaulting on the total amount because it's not all paid at once?
So they're considering the amounts obligated as well, I think.
Okay. And because that makes sense. But if it's based on he worked for 6 months and then defaulted, he would have only received 2, maybe 3 payments of the $65,000.
Yeah. And, we try really hard not to have people go into default. But, our attorney's office will be involved at this point if anybody's at risk of default, and they will determine how this formula works exactly. I know this language is pulled directly from NHSC, and NHSC does give you a lump sum up front. So I think that's where that, example is a little bit different.
Okay, thank you.
Yeah, so we want to support you to make sure you don't go into default. But it's really important to keep, communication open, and reach out to us with any concerns or anything. And that being said, I don't want to discourage anybody from being part of the program, but if there is, some question of whether you are able to finish your, service obligation, you do have 60 days from when you sign the contract to decide to, I forget exactly what the term is, but to decide to cancel your contract. So I'm not trying to encourage that for anybody, but this is a serious commitment, and we don't want to have anybody at risk for this. Okay, I see there's a couple of questions. So, Unoma, feel free to ask your question. I saw your hand raised. Unoma? Okay, Natasha.
Can you hear me?
Oh, okay.
Can you hear me?
There's a lot of feedback, but yes, I can hear you.
Okay, so my question is, regarding the penalty and the HS loan qualification, do you have to work for somebody to qualify for the loan repayment, or does it, or can maybe a single private practice, for example, qualify for the HS loan?
Yeah, so rural private practice is an eligible site type if it's a rural private practice. So you can have a sole proprietor rural private practice. Does that answer your question? And it has to be,
that makes sense.
Yeah, and it has to be in a HIPSA, and for the rural private practice, it has to be in a designated rural area.
Okay. Is there a place to go to know the requirements for that? Because I'm looking at, okay, what if you start with an employer and somewhere down the road you fall out?
Yeah, so
It kind
that's
of
why it's
makes you.
important. Yeah. Yeah, so for, the requirements on the site type, under eligibility and site type, this has the requirements for that. But I'm happy to talk to you individually about, what you're thinking. If, you do find yourself in a situation where you're going to change employers, it would be really important to reach out to our office before you change employers so that we can make sure it's an eligible employer, and you changing employers will still keep you as an eligible SLRP participant completing your obligation. So I can send you the information about site type, and then we can talk more about that. Does that answer your question?
Yeah, that makes sense, because I take that default seriously, because it's not charming to default.
Right. And then if you do become defaulted in our program, we do communicate that to, the federal programs that we work with, and you wouldn't be eligible for NHSC or anything like that moving forward.
Yeah.
Okay. Natasha, I see you have your hand raised.
Thank you. I'm sorry, my question was the same as Maria Rivera's. Was there an email, or should we just do what you described with the portal and all that jazz for Fed loans when their contract changes?
Okay, yeah. So we would have to do the request for change in the portal.
Great. And then the ADP procurement site sends me documents to review, and some of the stuff isn't anything that requires my action or signature. Is there something else that I need to be doing with that? Should I reach out to like the person that they've listed as like your procurement officer? There's two people there, I think, that respond to these messages, the main procurement person and then the one that's assigned to you through the ADP portal. I'm just a little bit confused about navigating that and making sure I get all the ducks in order for this.
Yeah, so that APP portal is not managed through our office, and I know it seems like it's very disconnected from our program, but and some of the things where they send notices out to you guys do not apply. But I'm not sure exactly what messages you're referring to, but I know that I've heard from some providers they're asking them to sign up for automatic payments like EFT payments to get paid automatically like EFT, but that doesn't apply to us because we're paying your lender. And I've reached out to ADOA, the office that manages APP, to see if our providers cannot be sent those emails, and they're working on that. So I apologize for that. I know that I've heard from other providers about getting solicitations or things like that. So yes, and so I need to look into that. But I wonder if there's a way in your settings in APP to turn those off, because really APP will not be like APP automatically generated emails should have only been done at the beginning when you were registering and to complete your profile to be active. Really, like those solicitation emails, unless you want those, but we're not going to communicate via APP to you anymore. You should really watch out for emails from my email address, Thelma's email address. Also, we have a workforce at AZDHS. So anything that's at AZDHS would be something you would want to respond to, because our procurement officers are specific to ADHS. So we would want to respond to anything from our procurement officers. But after you get your contract, after you sign your contract, really you would be working directly with Thelma and I, and anything from the PCO portal where you submitted your application. So sometimes I know you get automatic messages from our PCO portal. So really anything that has an AZDHS email or emails you want to work with. And I will, as a follow-up item, look into APP to see if I can find some guidance on how to unsubscribe from those solicitation emails. Does that answer your question, Natasha?
For the most part, Edith, I just had one more follow-up. I'm sorry.
No problem.
There was another solicitation that said, please sign this. And it was like referring to my work with correctional facilities. Now, I do take care of prisoners, but I don't work directly in a correctional facility. Do I need to still sign this? Send it back?
Is it for APP?
Yeah.
Okay. I can work with you directly on that. You don't have any other contracts with the state of Arizona, do you?
No.
Okay. Let's talk offline and we can work through your issues, but I will get back to everybody on how to unsubscribe from solicitation emails from.
Thank you so much. Sorry about the specific questions.
Okay. Thanks, Natasha. Okay. I have Naomi as next in the queue.
Hi, I have a couple questions just regarding the encounters versus hours documented versus how are we going to meet our hours. So in the contract, there was a designation of how many in-person hours versus telehealth hours. And just to throw some numbers out there, let's just say I put 80% in-person and 20% telehealth. But sometimes those appointments for telehealth were allotted about 30 minutes, but sometimes they take 15 minutes, sometimes they take 20 minutes. So is it really the number of encounters that we have that are going to be qualified for the payback service, or is it the number of hours documented? I ask this because we have an infectious disease clinic, but it has a very high no-show rate. So I wouldn't want to be miscalculated on the hours when I'm working in clinic, but there's a high no-show rate to the high no-show rates what I'm concerned about.
Yeah. So in the encounter reports, we aren't, making at this point, you are certifying that you did work those hours. And I know we're not going to say, oh, you had like one less encounter than should have happened or something like that. Really the red flag would be if you had 0 encounters or something like that. But your certification of your hours, along with your site admin certification of the hours, is really all we're looking for. We're not looking at encounters against any benchmarks or anything like that.
Thank you.
Okay, and James, I think I saw your hand raised.
I think you already answered it. I just wanted to see if there's a minimum number of patient encounters that we have to have.
No, as long as, if we see that there's 0 or something like that, then, that would be a red flag. But if you and your site admin are certifying that, you served that quarter, then, that's really what we're looking for. Okay, are there any more questions? Okay. And just back to default, just make sure that, when you're thinking of transferring sites, you work with us to make sure that it's an eligible site so that you can be able to fulfill your obligation. Okay, so I know you're barely starting your first year, so but I just wanted to give everyone a heads up that you are eligible for a 3rd-year renewal when you are in the middle of your 2nd year. So when you are finishing up your 2nd year, you may be eligible to continue onto a third year. You must have a HPSA score of 14 or above to be considered for the third year renewal application cycle. And that's open from March 1st to April 1st of each year. And if you don't have a HPSA score of 14, then you might be eligible for the October cycle if that's opened up, and that cycle is always contingent upon funding the October cycle. And we will send out emails, when providers are eligible to, renew in April. So given your contract is scheduled to be October 1st through September 30th, 2023, that means you'll be eligible to renew during March and April renewal cycle of 2023. So if you are eligible and you apply, notifications for the third year renewal will be sent in July, and then you will not be technically obligated until you sign your renewal contract. And so the way that it works is, this third year renewal is the first cycle of the year. So third year renewals get priority, and then initials, and then in June, and then if we have extra funding, we'll open up in October. So that's why it says all future renewals beyond third year is competitive, because all fourth year and on will be part of the October cycle if there's funding available after the 2 previous cycles. So that's an exciting thing to look forward to once you're in year 2 of your contract. So we also have a retention survey that goes out to participants, and it's across the state, across the nation, to look at state loan repayment programs and see how it's worked in terms of retention and recruitment of providers in different areas. So they have they'll provide 3 surveys, one in the beginning, middle, and end of your contract. So there probably will be one in November, early December. And then site surveys will be sent at the middle and end of your contract as well. So there'll be an email either from me or Thelma, but we work with this third party called Practice Sites. And that's the company that does the evaluation of the data. It comes from our email, but we don't see any of the survey, feedback that you're given. It's given to the Practice Sites, and they evaluate it and send it to us in aggregate. So feel free to be, honest and on your feedback, because it's not coming to us directly, even though our email is tied to it. And then just here is our website. So there's a lot of information there, but always feel free to reach out to us. So these are our primary points of contacts. It's me and Thelma. Thelma back in December or January. Excuse me. And then another thing that's really important is the Arizona Procurement Portal information. So if anything gets stuck, and I'll reach out to them about those solicitation emails to try to see if we can get those to stop for some of you. That's all I have for today. Is there any other questions?
Edith,
Yes.
for the quarterly, so our contracts start October 1st. Our first encounter quarterly report is going to be due at the end of December.
Yeah, it will be due in January, because you'll do encounters still through the end of December. And so then once the quarter ends on December 31st, then it will open up in the system, and then it will be due in the early part of January.
So the first disbursement to our loans will not be until January.
Right.
Okay.
And one thing that I didn't mention over in the presentation. But you know, we send out quarterly payments. So if your lender requires different, you know, schedule of payments, you need to work with them to, you know, either accept your quarterly payments or continue to pay so that you don't become at risk for default in your loans, because we will only send out payments every quarter. So sometimes I know that providers write letters to their lenders and say, you know, I'm on this payment, and they'll accept those quarterly payments, but it's your responsibility. Our office does not, besides sending the checks, we do not work with lenders on your behalf. They never give us information about you guys or anything like that. The only thing we do is, you know, verify service and send out payments according to what we have. And then I just wanted to say quickly before anybody jumps off, make sure that you put at any point during the presentation, you put your name in the chat for anybody who came in a little bit late, just so I can take attendance. So just make sure you put your name into the chat. And then I see two questions. Will you be sending out the slides to those who have already attended? I would like a copy. Yes, I will send the slides. We will post the video on our website for everybody to be able to access. Yes, so there's another question. Will we receive notification when the quarterly report due dates are coming up, or will this go directly to the administrators? No, you will get a reminder each quarter from our portal saying, you know, quarter ending September 30th is coming up. Please submit your quarterly report. So it will come to you as well. Are there any other questions? Just remember to put your name in the chat so I don't follow up with you for attestation that you attended. Are there any
Edith, you
other?
have.
Sorry.
I just wanted to make sure you had my name written down because I'm on the phone.
Robin?
Yeah, correct. Thank
Okay.
you.
Yeah, I got you down. All right, so that's the end of our call. So if you don't have any other questions, remember that, you know, our office is a resource for you. So feel free to reach out to us with anything you have throughout the years. Thank you, everyone. Hi, oops. Stop recording.